Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hi, everybody, and welcome to the Hanley Effect. I'm John Dyben.
I'm Rachel Docekal.
How you doing, Dr. D?
Hi, Dr. D. How are you?
I am well. Today, we have a special guest that is joining us, and we'll let her tell us about where she is. And,
Okay.
It's such a gift that she's joining us from a significant distance. She may actually be at least in the top two of,
Furthest
people.
away.
That's right.
Furthest away.
But today we're joined by Dr. Annie Brook. She is a psychologist, an educator, and she's an author who looks deeper into not just what's going on, but how patterns begin. And, you and I have talked a lot about, somatic work lately and what that
Yes.
means. And it's been an interesting topic. And so we have someone who is a real expert in movement and somatic work and in
So
psychology. So
exciting.
we're so excited. Dr. Annie Brook, thank you for being with us today.
I am so happy to be with you and also with your viewers.
So, Dr. Brook, would you tell us, we always like to ask our guests to tell us who you are, tell us about the work that you're doing, and then we're always fascinated to know people's journeys. Who are you, what do you do, but then what brought you to do what you're doing today?
Okay, we will dive in, huh? Yes. So I am a psychologist. I have had a clinic for 17 years helping people. I train therapists. I was a former director at Europa University in their master's program for somatic psychology. And now I continue as an educator and an author because I want people to know how to listen to stories in our experience that happened before we could even think. So when you think about that, this is very young memory that is experienced that shows up in our primitive brainstem as protective responses. We might say habits, even before we don't know why we do them. And so often, many people really have a good intention to make changes in their life, to have things work better, to help their children, and they're stuck. So that's what I do, is help people get unstuck by understanding through sensation awareness and integration of, what happened, so that they can be happier and healthier. And for me, I got into this because I was growing myself. I had had some really big traumas in my early 20s, and I had a house burned down. My partner started drinking alcohol, and I was like, what do I do? And so I became very worried. And I don't know if any of your people know themselves being someone who worries a lot.
Yeah.
Well, that much worry after such a big trauma had my brain not function very well. I couldn't hold a job. I could hold it for a little while, but I was so full of just, what do I do? This is such a big thing. And what I discovered is a meditation, which actually it was from the Sufi practice, and it taught me to stabilize my brain. What it allowed us to do is go, put your attention inside your body. Don't put it out there at all your worries. Put it inside your body and learn how to stay present, to relax. And then you start throwing out all the struggles and not letting them be right in your face. That's a simple way to say that there's practices anybody can learn that help them restabilize after difficult events. And so I started with that healing. I got really stable. I studied for 4 years in a training program that used movement and group, like understanding how a group process works. And I started to heal, and I was like, "Oh my gosh."
Hmm.
I thought I was forever broken. And I started getting stronger and healthier and happier. And I went and taught at the meditation school. I volunteered at Children's Hospital to work with children who had trauma. I started becoming a therapist and helping people figure out what was the hidden story in their body that would get in the way of feeling healthy. And so it's kind of the way where people don't know why they do certain things, or maybe they have nameless anxiety. Maybe they wish they wanted to stop, being reactive when their partner is home with them, and they don't know how to stop. And that's because the brain has already a pattern that says, wait, and we have to learn to be a detective. We put on our detective hat, and then we follow what happened all the way back to infant memory. Now, that's really my specialty, is what happened before you could even think. And I got interested in this because as I was growing and healing and understanding, I became aware that when I began my life, my connection with touch and safety and protection with my mother, I was whisked away because I was born premature. That
Hmm.
means it's almost like you don't have enough skin. So you're hypersensitive. You are put in a little box to grow more. Meanwhile, maybe they put a tube up your nose. And for me, I had no touch for the first 17 days of life,
Wow.
just
Wow.
technology.
Right.
And that was terrifying to my primitive brain. That's what we have to remember, is we have these experiences that are primitive. They're not cognitive. We can't think about it. And so when you have so much overwhelming situation, you don't know how to relax. So I studied, I learned, I had practices, and I really figured it out. Wow. Wow. I can relax. I can enjoy. I can think clearly. I don't have patterns that cause trouble. And I learned this in such a way that I think anybody can learn it. And that to me was the personal gift. And it was also something I wanted to share with others.
The whole idea is fascinating. So you're a psychologist, and you utilize movement, dance, feeling, and it's when I think sometimes when people hear that, they're like, what in the world does psychology and movement or dance have to do with anything? And I think what you just said is so important, because you said that your focus is working on memories and patterns that exist in our brainstem that are not cognitive,
Hmm.
and those things, if I've got it, those things, they're not cognitive, but they are impacting our patterns, our feelings, our everyday life right now. And so the work to reach them, to change them, to move them, has to be beyond cognitive.
Yes. You have really summarized it accurately.
Eh,
So that's
eh,
why, go ahead.
no, please tell us more. I
Tell us
Yeah.
love
how
understanding
this
this.
works. Yeah.
Yes.
It's really fascinating, and it sounds like, what? Could that really be possible? But if you think about it, we are designed to take in experience and respond to it. Something happens and we respond. We are hungry, we go get some food. We call that sensory input, sensation. and movement motor output. Now imagine you were just feeling comfortable and safe and you went to get your food and somebody kept pulling your food away. Every time you were hungry, they pulled your food away. All of a sudden, your sensory about hunger ends up with a fight or a struggle. Oh, I cannot satisfy the sensation of hunger. That can happen with a baby who struggles to eat. Sometimes babies will not feed after birth, or sometimes the mother doesn't know she's trying to nurse the baby and there's not enough milk. I have heard stories from grown-ups who say, gosh, my mother told me when I was born that for the first month I was starving. They didn't know that my tongue would not connect strongly enough to pull in the milk from the mother. So I was a starving baby. And then that person grows up and they have an eating disorder. They can never fill in the panic of a hungry baby because they don't know where that came from. They don't remember they were a starving baby. So when you want to heal something like that, like a grown-up doesn't like having an eating disorder. They don't necessarily want to stuff themselves just to relax because there's a lot of side effects. But then to find out that it's a starving baby, you have to imagine, like, what would it feel like to somebody who every time they ate, there was never enough food. So first we start with our imagination. We start with the story the mother told the adult. When she's a grown-up, the mother tells her the story. And then she goes, oh, when I was a baby, wow, that starving feeling, it's kind of familiar. And then I will ask questions like, what do you think the baby did with the impulse it need to eat and there was no food? What do you think happened? And so we start thinking about neurology and behavior and responses. And so we know in our nervous system that if we have too much need that does not get met, then we will freeze. First, if there's a struggle, we will fight. We will fight to eat. But then there's no food. I cannot make it happen. I cannot run away from the hunger pain. So then I just go numb. I stop. I can still breathe, but I'm numb. And so now we have a frozen body. Somebody can still think. They can not feel so much, but at least they're not feeling hunger. Because they can't tolerate, a baby cannot tolerate hunger forever. So that's how
And
some of these things start.
And that's that survival part of the brain, that fight or flight or freeze that's there, first, that's the earliest developed part of the brain. It's there before we're really even having that cognition that you're talking about. So that
That's
makes
the key.
total
Yeah.
sense.
Yeah.
So,
So
Ann,
go ahead.
how does somebody understand that maybe a challenge that they're having goes all the way back to these primal memories and just those first few months of life? How do
That's a
they
great
identify
question.
that?
Yeah. Usually people have tried a lot of different therapies. They have tried to change a habit. What I listen for in terms of did it start early is I think all the way back to what we call phases of being born. That birth is such a physical experience. The baby has to enter the birth canal. It has to start. It has to handle pressure. It has to move. It has to follow through. It has to succeed. And then it has to recover and celebrate. That's an ideal, easy, good enough birth. But what can happen is a person, an adult, is like, I never start projects. I am afraid to start projects. I don't know why, but beginnings are hard for me. And I'm like, I wonder what was the hardest beginning. Sometimes, if the baby didn't know that they were being born because the mother had anesthesia, the baby is not conscious. They don't know how they got started. I don't know. And so I listen for what I call the echo in adult behavior. Another example, say a person, they start things okay and they're moving along and then they totally forget what it was. They don't remember, oh, I better follow my deadline. They forget about it. And then I'm listening where, if you start to study this, you learn that during birth, they often give the mother medicine, and the medicine is to take away pain. But what the medicine also does is it takes away the connection of awareness between the mother and the baby. So all of a sudden, the baby is like, wait a minute, where am I? I don't remember anything. I worked with one woman who was in her 50s, and she had her problem. She couldn't survive without writing lists of everything. She had to have a list and list and list and list. And it turned out in her time of being born, they always gave the mother chemicals that made the mother fall asleep at birth. Nobody is aware. And what the chemical was made of is something called scopolamine, which is a memory blocker. It actually didn't take away the pain, but it blocked the memory of the birth for the mother and the baby. Now, doesn't that sound so weird? And yet, here was this woman. She couldn't remember. She couldn't remember. What happens in our primitive brain is it is always awake. There's a part of the brain called the amygdala that scans for danger. Now, that part of the brain is wide awake prenatally. That means from the time we're in utero to being born to after birth, this part of the brain is seeing, is the world safe? Will I survive? Will I survive in connection and relationship? And then will you keep me safe? So if you cannot remember and it's dangerous because I need my mother to feel safe, then I'm going to write lists and lists and lists. So it's an interesting detective work.
It's
fascinating.
fascinating. Yeah.
We have a perinatal program here where we bring in mothers who are pregnant and are struggling with
Yes.
addiction. Well, and one of the gifts of that is that when here and where we're at, if typically if a mother gives birth and the baby tests positive for any drug, that baby is then whisked away from the mother, is in foster care system. It often, in the hospital alone for that time, like you described. And so a big part of our passion here is that if we have an agreement, so that if women who give birth are in this program here, that baby stays with them.
Mom.
And there's so much.
I'm so happy to hear that.
And as you're talking about all of this, because there's so much research and there's so much knowledge about why that's so important, but even you're just reinforcing that for me that it is just so critical. I, however, have to be the bad guy because
Yes.
I'm getting the moments I'm getting the wrap up from our producer. But first
We're
of all,
just getting started. That's funny.
know this could go and we could just keep going and keep going. But I have to wrap it up for now. But I want to ask two things real quick. One is in just a second, we are going to ask you to have the last word and to think about what is one message that you would want our audience to hear from you today? But before that, if people want to learn more about this, if
Yes.
they're saying, man, we're just getting started and I want to know more about this, how can people who are listening find out more about this work?
Thank you for the question. First, they could go to anniebrook.com, just my name, ANNIEBROOK.com, and they could look at my website, they could go to the store, and I have books there. So the best books on this, if you really are a therapist or you really want to know, is called Birth's Hidden Legacy, that there's a hidden story inside the body mind. So you could get Birth's Hidden Legacy. I send them out all over the world. Therapists get them, mothers get them. There are shorter ebooks also, just a short ebook on birth trauma. There are video programs called Transforming Echoes. You could watch a whole video set that will guide you through attachment, birth, even adoption. So I have lots and lots of resources because I'm so passionate that people have the help they need. And that therapists ideally get this extra training. I train therapists. I am teaching in Thailand with some therapists, getting them these skills. And I love sharing the idea. And this is what you were asking me. What do we want to leave with? You want to know that you are not forever broken,
Mhm.
that it's about the tools that help you align so that your story is no longer like this, a filter trying to save you, but that you already are okay. And that these activations are actually leftover memory that you can learn the skills. It's not so hard. I teach hundreds and hundreds of people to put to rest. And I teach even like a
Beautiful.
4-year-old comes to my office. Right away, she's showing me that she doesn't want anybody to come in because she was born C-section. So she's
Oh.
behind the Japanese screen, pulling the tape off the wall, taping up the crack between the panels saying, "Don't you come in." And I'm like, "Oh my gosh, honey, this was so scary for you." And we do the treatment with children. We help the story relax and the child relaxes and the mother feels happier. So you can help children. Therapists can get these skills and help many more people much easier when you go all the way back to the very beginning. I'm so
Well,
grateful to you for understanding that the babies have to stay with the mother.
oh, it's so important. And
Mm.
thank you so much for that message. I wish we had more time, but that message, you are not broken forever. That I think we're going to carry that with us today.
I love that.
Dr. Annie Brooks, thank you for being here.
This was wonderful. Thanks so much.
Dr.
I'm
D,
so happy to be with you. It's my pleasure.
Dr. D,
Dr. D,
this
and
was
thank you
great.
everybody who is watching or listening. We'll see you next time on the Hanley Effect.
Bye, everyone.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.